Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, July 16th, and this is my daily briefing. To date, we've had 151 cumulative positive cases in Missoula County. 148 of those were identified by testing, and 3 were epi-linked. We've had 106 recoveries and 1 death. 1 Missoula County resident remains hospitalized, and we currently have 44 active COVID-19 cases with over 350 close contacts. Active cases and their known contacts are in quarantine and isolation and will continue to be monitored and supported as needed. The state of Montana is reporting 2,231 cumulative cases, which is up 134 cases since yesterday. There are now 1,226 active cases with 37 active hospitalizations across the state, and there have been 35 deaths related to COVID-19. Yesterday, Governor Bullock held a press conference announcing a mandatory face covering rule in certain settings in Montana counties with 4 or more active cases. This is a welcome directive that's in alignment with our local operations. We are hopeful that the statewide mandate, when used in conjunction with other safety practices, will help slow COVID-19. Remember that the idea is to distribute the positive cases more evenly across time so that our healthcare hub and healthcare infrastructure can keep pace with COVID-19 without working beyond their capacity. We will still continue seeing cases, but this will help slow the spread and distribute it across time. There are some facets of the governor's rule that are stricter than our local rule and health officer order, and there are some components of the local rule and health officer order that are stricter than those from the state. So I'd like to review and clarify what the mandate looks like in Missoula County for Missoula County residents as well as all visitors to Missoula County. Typically, the stricter of the two is what is followed, and I'll outline what those differences are and how we'll move forward from here. First, the governor's directive requires that people age 5 and older wear face coverings in certain settings. Our local rule and order require that people ages 12 and older wear face coverings in certain settings. Since the governor's directive is stricter, Missoula County follows the state mandate and requires all people age 5 and older wear face coverings. Second, the governor's directive allows for face shields in replacement of face coverings, while the Missoula rule does not allow for that. In Missoula County, face shields are not a replacement for face coverings, and we continue requiring the use of face coverings until further notice. Remember that the face covering should have a good fit for your face, fully cover your nose and mouth, and have a snug seal at the base of the chin, ensuring that your respiratory droplets do not escape from above or below the face covering. Third, the governor's directive is contingent upon the number of active cases in your county. Local rule and order are not dependent upon the number of active cases in the county. As such, our local order and rule will continue being in place until further notice. Our Board of Health and Health Officer will reassess the rule, including implementation, compliance, enforcement, and its effect on COVID trends in our county on a monthly basis. In addition to standing monthly meetings, the Board of Health, Health Officer, and Incident Commander remain in communication, ensuring that leadership is apprised of the information in real time so that they can make informed decisions in real time as needed. So that was a lot of information, and I'll review it once more just to verify that we're all on the same page. In Missoula County, people ages 5 and older are required to wear face coverings when inside public settings, as well as when they are outside in certain settings per the governor's directive. In Missoula County, face coverings are required. Face shields are not an admissible replacement for a face covering until and if and when the Board of Health and Health Officer revisit and amend the rule and order indicating otherwise. Finally, in Missoula County, people are required to wear face coverings until further notice, regardless of the number of active cases in our county. Several states have implemented mandatory face covering rules in the past few weeks. We're proud to be the first county in Montana and one of the first states to formally adopt a rule for public health and safety. With the rise in the required face coverings, we've also seen a rise in scams that are related to things that are being called mask ID or mask exemption IDs that are supposedly issued and endorsed by agencies like the Department of Justice and the CDC. We saw this start happening in other states and have already passed face covering rules before us, and now we're seeing it in our state and county. We've seen ads in our local newspaper as well as on social media suggesting that there are mask exemption cards for sale. These cards are not valid and they will not be accepted if and when presented to indicate that you are exempt from the rule. The Department of Justice formally announced today that those who may see a card or flyer with a DOJ logo stating that the owner or wearer is exempt from wearing a face covering have not actually been endorsed or issued by the Department of Justice. Health experts, let me try that one again. Health experts and the Department of Justice also urged the public not to believe in the claim that wearing a mask will incur mental or physical risk as described by these fake exemption cards. Sometimes the cards claim that Americans with Disabilities Act forbids asking about the cardholder's health condition aggravated by wearing a mask. The card threatens that if questions were asked, financial penalties of up to $75,000 or higher can be levied, and that is not accurate, and it is totally misinformation. An official alert from the Department of Justice and the ADA states that they are not the distributors, nor do they endorse the information on those cards that are being distributed. We've also seen other cards with misinformation being created and distributed, indicating that a face covering is unhealthy and ineffective, which is not true. The Center for Disease Control and Prevention recommends wearing a face mask or face covering when going out in public as a way to slow the spread of COVID-19, along with social distancing and hand washing. It's unfortunate that scams like this are happening. We strongly encourage people to do your homework. If something feels weird, it probably is. It's unfortunate that some people will try to take advantage of others, especially at a time like this with a situation as serious as this, but it does happen. So remain diligent and practice those safe behaviors. Mask up, wash your hands, clean, 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 and keep your social circles small. Connect with our call center at 258-INFO if and when you have questions that need clarification, or if you'd like to schedule a test for COVID-19 if you're having symptoms. There's so much information coming out in real time. We're here to help, so definitely use us as a resource. So that's it for my daily briefing today. As always, you can follow us on Facebook at the Missoula City County Health Department's Facebook page. Please be respectful of your fellow citizens there. You can call 258-INFO if you would like to schedule a test for COVID-19, or again, if you have any questions, you can certainly call that number. Check out our website at missoula.co/cvirus for more information and guidance. And as always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that little notification bell so that you get notified whenever additional videos are uploaded. And that's it for today. Everybody be healthy, and I will talk to you again tomorrow.